Hi guys, so I just wanted to do a really quick video just to explain the difference between scleral and corneal lenses, especially in the situation of keratoconus. So as you guys probably know, with keratoconus, the surface of the eye, I'm going to do a little cross section, is a little bit irregular. So it's a little bit coned. So if we kind of do that and assume that this area, not great at drawing, but excuse me, is the cornea, and this is the white of the eye here, which is the conjunctiva or the sclera. So essentially, cornea that's got keratoconus is quite steep and it's irregular centrally. So what happens is when we typically try to fit a pair of glasses or traditional contact lenses to this eye, there's too many light rays hitting stray points across this, so we can't get a clear image. So the challenge is, I say, the stray light hitting the eye, and therefore we can't get, or keratoconic patients can't get a clear visual image because of this irregular surface. So it's difficult with glasses, and therefore we have to fit some kind of contact lens to compensate for the fact that this cornea is a little bit irregular. So you have some soft contact lenses out on the market which are able to kind of just float over this irregular surface. They're soft, so essentially the soft lens is kind of draping over that irregular corneal surface. So if this is good, this is okay for mild keratoconus, and it kind of works quite well with mild keratoconus because it kind of forms another barrier. It drapes over the irregular cornea, giving you a little bit more of a sharper picture and gets good results. Secondary to that, and the alternative is what we call corneal lenses. So these are typically very small, rigid gas permeable lenses. And these are kind of based, again, riding and resting on the surface of the cornea. They're generally much smaller, so they do tend to move around a little bit, but essentially trying to create a new surface again to focus in on that light. Corneal RGPs, so rigid gas permeable lenses, kind of create a new surface for the light rays to focus through. And again, it's good for mild to moderate forms of keratoconus. Challenges are with that is because it's physically resting on the surface of the cone. If the cone or the cornea is quite sensitive, which it can be with people that suffer from keratoconus, sometimes they can get ill effects of comfort, and in some cases that can rub on the cone itself and cause a little bit of scarring, potentially causing some impacts to the vision. So as long as fitted well, not too much of a challenge, but various things that we need to bear in mind and think of. So how are scleral lenses different from that? So scleral lenses typically are much larger in diameter than soft, and definitely with corneal RGPs. Essentially what they do is they create a brand new surface that vaults over the whole of the cornea. So what happens is there's tears or fluid, and your tear exchange fills out all these voids, all the gaps between the irregular corneal surface. Um, so essentially, because it's almost creating a brand new surface, the light rays can focus much better, giving a much better, higher level of vision. So these are, as I said, scleral lenses or mini sclerals. The main difference, the concept's the same. It's just that a mini scleral tends to be a little bit smaller, easier to get in and out versus a kind of very large, full diameter scleral lens. As long as they're fitted well and the designs are good, the visual impact is very good. The benefit, again, this is really good for people with moderate to severe forms of keratoconus. Main benefit is that it creates a whole new ocular surface, or a whole new refractive surface, I should say, which gives us the kind of really good, stable, clear vision that we want. Because the lens is very large, it doesn't tend to move around much. So again, the vision is very, very stable. And also because there's a lot of tears pooling behind that lens, it's really good for comfort as well. Typically, people that have worn soft or rigid gas permeable lenses that switch over to scleral, mini scleral lenses, really note the improvement in the comfort, because there's nothing essentially touching the cornea at all. It's completely covered by the new scleral lens, and also there's a lot of tears pooled, as I say, behind that, so it keeps the eye nice and comfortable. It's even used in patients that don't have keratoconus, which have various corneal diseases. Again, just needed to kind of produce an extra barrier from the environment and keep the eyes kind of nice and comfortable. As I said, the other benefit is because there's no bone contact, because there's no contact at the front of the eye. There's no concern about causing scarring or further irritation to the cornea in itself. So they're kind of the big differences between soft lenses, rigid gas permeable, and sclerals and mini sclerals, and when we would try and fit them. As I say, we do tend to prefer mini sclerals these days with moderate to severe, but there's nothing said or there's no reason why, even if your keratoconus progression is only mild or moderate, that you wouldn't really benefit from a mini scleral or a scleral lens. Anyway, I hope you guys found this useful, and yeah, give me a shout if you need anything else. Cheers, guys.